Good afternoon, everyone, and welcome to the Diabetes Lunch and Learn today. So I'm Laura Williams. I'm one of the programme managers at West Yorkshire Integrated Care Board, and I'm joined today by a panel of members, and so I'm going to introduce them all shortly. What we decided to do was, because today's World Diabetes Day is a bit of a two-pronged approach to some education, because that's the theme for this year. So we're going to be looking at increasing awareness for our staff and our volunteers across our West Yorkshire healthcare system in terms of knowing your own risks of preventing diabetes, and then also for anybody working with our patients across West Yorkshire to look at things like the National Diabetes Prevention Programme and other programmes that we've got on offer to make sure that you know the right places to refer your patients to. So just to introduce our panel today, we've got Waqas Tahir, who's our diabetes clinical lead across the West Yorkshire system. We have got Lisa Holland from Diabetes UK and Katie Coppis from Reed Wellbeing. So at different times throughout the session, they're going to be taking over as guest speakers. And then we've got Adele Brereton from our West Yorkshire Integrated Care Board team, who's going to be doing a short piece about the programme on offer. For those of you that love Twitter, as we all do within our team, we would love you to share what's happening today and what your learning is and what you're going to take from the event. So if you want to use the hashtag World Diabetes Day and tag us in any tweets, that would be wonderful. Our handle for Twitter is @WY Partnership. The session will be recorded just for learning purposes for anybody that can't join us today. And there is a questions chat rather than a normal chat function on Teams. Now you can write answers in there to things that we might ask you, and you can also write your questions. You can write your name will come up, or it will give you an option to remain anonymous if you would rather do that. So what we want to do first is just ask you to use that question and answer function and give us a bit of an answer as to why you're attending today. So is that for personal reasons, professional reasons, or a bit of both? So I'll just give you a minute to do that now. And then the second question, when you're ready, is what do you want to get out of the session? This is just to help us in future inform what things we might be able to tailor make and to make sure it's worthy of your time. We do appreciate that it's lunchtime, so you might need to eat at the same time as this, and appreciate you're all busy people, so thank you for being here today. Just give you a minute to do that now, and then we'll get those answers from you later. I think at the moment that's everything that I've got to go through with you now. So we'll just give you a few more seconds to finish up writing those answers to those questions. And then hopefully we'll pass you on to our first guest speaker. Oh, sorry, I've forgotten already. So we've got a couple of questions to ask you, just as a bit of a baseline understanding really to see what everybody thinks so far. So out of 100 people who are at highest risk of diabetes, how many will go on to develop the condition in the next 5 to 10 years? So if you just have a think about that one, and we'll share the answer with you in a few seconds. Okay. So the answer is about a third, but it does vary across the population. So it's quite high numbers in terms of how many people who are at high risk will get diabetes, which is why prevention is so important and education is so important. Move on to the next question now. So on average, how much weight do people lose by attending the National Diabetes Prevention Programme? Just have a guess of that answer. Okay, moving on. 3 kilograms is generally the answer, but in West Yorkshire, most people lose just over 4 kilograms, which is absolutely fantastic. So well over half a stone there. So it is a really good behaviour change programme that you'll hear more about in a little while. And the next question, this is the last question for now. So on average, what's the reduction in HbA1c as a result of attending the National Diabetes Prevention Programme? So just moving on to the next answer. So between 4 and 6 millimoles, depending on the area. So it does make such a big difference to the longevity of somebody's health by coming onto that programme. So hopefully that's given you a little bit of a taster as to things that you might learn for today. I'm just going to hand over now to Waqas Tahir. So Waqas is our diabetes system clinical lead for diabetes, and he's going to talk you through some of his slides now. Hi Waqas, thank you.
Can someone share my slides? Sorry, if that's okay.
I think Rachel's just doing it now. Bear with us.
Thank you.
Rachel, have we got the slides for Waqas? They're ready.
While that happens, don't worry, I'll just start. So first of all, thank you for the opportunity to come and speak to you all and to be part of such a wonderful day. Clearly, I haven't got a blue background, but I'm in blue, so that'll count. So a happy World Diabetes Day to everyone. So I'm just going to basically talk very briefly around diabetes prevention and the impact it has or is having on people living with diabetes. And there are sort of a few things that I just wanted to kickstart with. One is obviously just making everyone aware in terms of World Diabetes Day today, 14th November, but more importantly, what are the themes? So over the last 2 years, the main 2 themes for globally have been around access to diabetes care, and then secondly, for this year particularly, has been around the topic on education to protect tomorrow. So when we look at access to diabetes care, we know that millions of people with diabetes around the world do not have access to even basic diabetes care. And one of the urges from the global community is around the fact that, you know, we cannot wait any longer for either things like medicines or technologies or support and care to be made available to all people with diabetes that require them. And some of those support efforts are around highlighting the awareness around World Diabetes Day, and more importantly, to sort of ask governments to increase investment in diabetes care, particularly around prevention. And the second element, which is more in keeping with this year, is around the topic on education to protect tomorrow. So what we mean by that is that there will be lots of activities that are focusing on highlighting the need for sort of better access to quality diabetes education for health professionals, as well as for people living with diabetes. And in that realm, there is, colleagues may wish to have a look afterwards, or otherwise we'll send a link around as well. There is a new online platform that's been launched, and that provides sort of free interactive courses to help people with diabetes and their carers as well to understand and how they can manage their condition. So that might be something that colleagues may wish to tap into. Next, please. So I'm just going to very briefly talk about, for me, is the big picture. And before we sort of delve into this big picture and talk about all these different topics here, I just wanted to sort of highlight the scale of the problem at hand. So we know figures from the International Diabetes Federation from across the world that there are approximately 463 million adults between the ages of 20 and 79 who are living with diabetes. And the estimation is that by 2045, this will rise to about 700 million people. Obviously, the majority or the larger proportion is of people with type 2 diabetes, and that's increasing across most countries. And we also know that almost 80% of adults with diabetes are actually living in low and middle income countries and societies. So again, if you look at the current climate or the socioeconomic climate, we know that that will have a more significant impact, particularly on people living with diabetes, or even the progression towards people with diabetes. And just if we look at the UK in particular, we have estimated figures of about 4.7 million people in the UK who have diabetes. And to put that in perspective, almost someone is diagnosed with diabetes almost every 2 minutes. So if this webinar goes on for about an hour, you can do the maths there. There are lots of people who are just diagnosed within the UK. So one person with diabetes diagnosed every 2 minutes. So that's how significant and how rapidly things are changing. But also it's the fact that these conditions have devastating consequences and complications for people living with diabetes. Again, just some brief stats and facts. If we look at it, even nowadays in a first world country like the UK, every week diabetes is leading to almost 169 amputations, almost 680 strokes, over 500 heart attacks, and almost 2,000 cases of heart failure per annum as well. And almost 500 people sadly die with diabetes prematurely, so that's earlier. Sadly, every week, and that's despite all the brilliant efforts that we do in terms of awareness, highlighting the problem, and supporting the diabetes community. So who do we think is at risk? So your risk of type 2 diabetes increases the older you get. So 1 in 5 people who are above the age of 65 has diabetes. So again, you know, if we look at the clients or people that you may have interactions with, you know, 1 in 5 over the age of 65, again, who are socially perhaps dependent, that's a huge number. Again, other factors to bear in mind is that it also increases in certain communities or certain ethnicities as well. So for instance, if you have a close family member with diabetes, or if you're from either Black or South Asian background, these are again significant risks. It amplifies the risk by either 2 to 4-fold, depending on other factors as well. And again, we know that someone's risk is also increased by being overweight, and especially if we look at having excess or carrying excess weight around the belly, and also as well as if someone may have high blood pressure or have hypertension. So these are majority of the factors where perhaps some are genetic, or for some things you can't change, but there are a lot of these risk factors which you can do something about, perhaps by being more active, eating better, or losing weight particularly. So I'm just going to briefly touch on additional health problems. So we know that there are other conditions associated with either being at risk of diabetes. So these include things like high blood pressure, which we mentioned. Some of these patients might have abnormalities in their cholesterol levels, and as well as just not only being overweight or carrying excess fat as well. And we also know that people with diabetes are twice as likely, sadly, to suffer from depression, and are more likely to be depressed for longer and more frequently. So we're trying to just build a trying to build a picture that you might see someone and you might think that, oh, yep, I know this person, they've just got diabetes, but actually there are a lot of other things that might be happening in that person's life, and how all these things might be related or linked with each other. And it's important to remember that people who are at risk of diabetes, they also often have the presence of additional chronic conditions. Almost 2/3 of people living in the most deprived areas have more than one comorbidity or an additional condition present at the time of their diagnosis. So we might be diagnosing them with diabetes, but already they've got another chronic, long-standing health problem. And as many as almost 40%, or at least 1/3, have almost 3 additional health problems. So again, diabetes on its own you would rarely find, but often it's part of long-term conditions and multiple other health problems. So quite often you might find that when you are supporting individuals for other health problems, for instance, like asthma or joint problems, muscle aches, or severe mental illness, it's more often than not, or most likely, they possibly will be either at risk of diabetes or may have diabetes as well. And clearly these conditions have a significant health and financial impact on both the service user as well as the associated services for that matter. So it's not all gloom and doom, because there's a lot we can do. So what can we do to either prevent or delay the onset? I think it's important to recognise that if you are at high risk, if you're in the high risk group, either determined by the online risk tool, which colleagues will discuss today, there is 1 in 3 people, they will get type 2 diabetes in the next 10 years. The other way you could look at it is that 2 in 3 people, we can slow it down and stop it from happening. So again, there's lots we can do. And a lot of the simple measures include just, advising on healthier lifestyle choices that can help your clients, users, or people that you see either prevent and slow down the progression of type 2 diabetes, even if diabetes runs in the family. So one of my requests is that we should try to encourage people who you may interact with or service users just with some simple messaging, sort of advice around either eating healthy foods or at least trying to get them more active, either moving more, walking more, or trying to support them with getting more activity, more aerobic physical activity into or structured into their day. And again, the purpose of all this is to focus on losing excess weight, as well as if they have other health problems like blood pressure, etc. It would also have benefits across those domains as well. And for those of your service users who may be smoking, again, just having that early conversation, what do you think about smoking? Do you know it causes this, that, and the other? And that might just be enough for them to stimulate to take upon some action of their own. So alone we can do so little, but together, and this is why we're all here today, we can do so much more. And we know that data from the initial pilot sites looking at diabetes prevention, people on average, again, if we support service users into that, people on average from the diabetes prevention program, they lose an average between 2.5 to 3 kilograms of weight, which is amazing, just with doing some advice around exercise, activity levels, etc. So my appeal to everyone here, how you can help, I think first of all, it's about being vigilant and being able to recognize some of the risk factors, just simple things like that, that once you recognize that, then I'm hoping that from today's conversation and today's fantastic sessions from other speakers as well, you'll understand in terms of all this possibly could be linking up to their progression to type 2 diabetes. So things to just pause and think about perhaps are when you do see the next service user, perhaps later on today, just quickly, are they overweight? Do they have a large waist size? Thinking about, are they eating lots of processed meat or fizzy drinks, for instance? How active are they? What can I do to help them move, perhaps? What age group? Are they younger or are they old? The risk, again, is being higher. Is there a family history? So you might have a carer or supporter or a friend or someone who might know. Do they belong to sort of, like I said earlier on, a risk factor, Black or South Asian ethnicity? Again, that heightens the risk as well. How well do they sleep? We know that certain sleep disorders also escalate or increase the risk of diabetes for that matter as well. Do they smoke or do they have high blood pressure or heart disease? So these are simple things where you will have that background information before you've even gone to see that client or service user. And it's just helping you build a picture that this person could be at risk of diabetes, and therefore perhaps there are certain things that I could do just to help them. Or if they have visual problems, and if they do have any of these things, or these things you think, oh yeah, this probably fits into the pattern, you could support them and encourage them to use the online Know Your Risk tool from Diabetes UK, and that just puts them into a risk category where they can then seek further help and support either from the doctors or either be referred into the National Diabetes Programme. So at the end, I'll leave us with that, just with one small message around Know Your Risk. Thank you very much.
Hi, I'm Lisa. I am the Engaging Health Manager for Diabetes UK, and it's fantastic to be here today. So I'm going to go through the Know Your Risk tool that is available on our website. So just bring up now. Thank you. So The Know Your Risk tool aims to help individuals find out their risk of developing type 2s within the next 2 years, and was developed in collaboration with the University of Leicester and the University Hospitals of Leicester NHS Trust. This tool can be used in preference to a finger test tool, as it takes in considerations of the risk factors for diabetes. This avoids falsely reassuring people who may have a normal glucose level that they may be still at risk of developing the condition. Next slide, please. So, finding out the risk of type 2 diabetes only takes a few minutes using this tool. There on the screen is the web address that takes you directly onto the Know Your Risk tool. But if you just go onto our website, which is diabetes.org.uk, and in the search engine put Know Your Risk, it will take you to this page. By completing the tool in England, it will allow you to be eligible for the Healthier You NHS Diabetes Prevention Programme. And to calculate your risk, all you need is to know your accurate measurement of your height, your weight, and your waist. Everything else calculate as you go through the questions. So we say before you start, just grab a tape measure and the scales and work out your weight, height, and waist measurements. Next slide, please. So the one thing that we do need to make sure before anybody starts is you can't complete your Know Your Risk tool if you're under the age of 18, if you're pregnant, or if you've had a baby within the last 6 weeks. This is because it's an evidence-based program system, and things are slightly different if you are under the age of 18 because you could still be growing. Obviously, if you are pregnant or you've had a baby within the last 6 weeks, your weight and obviously your waist measurements are going to be slightly different, because it does calculate it on family history and body mass index. So next slide, please. So it is an evidence-based tool, as I've said, and it's on questions that are asked. So when you go onto the screen, the first question is asked is, what is your gender? We do know that males have a slightly higher risk of diabetes, but we also say is if anybody's undertaking this tool, the percentage of whether you're male or female is slightly different. So we just ask people to put down whichever gender that they feel most comfortable at. Next slide, please. We then also ask how old you are. This is because we realise that the older you are, the higher risk you are of developing type 2 diabetes. So again, we just ask them to put the age that they are now when they're taking the test. Slide, please. The next question that is asked is, what is your ethnic background? Again, we ask this question because we know that some ethnic groups have a higher chance of developing type 2 diabetes and at a younger age. And for this purpose and for this presentation, I've just the ethnic question I've popped down is South Asian, just as an example. Slide, please. The next slide then is how to calculate your waist measurement. You can do that either in imperial, old school, or metric centimeters. And it also shows again, we're not asking for your jean measurement or your trouser measurement, because that's slightly lower, and then the actual sort of waist measurement, and that diagram there shows you exactly where we class your weight measurement to be as an effective tool. Again, just pop in the weight measurement. I've just put 36 inches here just as an example. Next slide, please. Again, we ask then about your height measurements. I've decided for this purpose, this person is a 5'5", and also the weight measurement, and I've just, for example, put 15 point. When you put these measurements in, the tool automatically calculates your BMI, and in this instance, it's 33.3. If you hover by that question mark, it will explain how that measurement has gone. So the next slide then is the other risk factor, is whether you've ever been prescribed medication for high blood pressure. Again, that does affect your risk of developing type 2 diabetes, and for this instance I have put that for this example that the person hasn't ever been told that had high blood pressure. Next slide, please. So the next thing is, it actually, from those few questions that have been asked, which are really, really simple, it then just, before it calculates your risk, it does ask if you would like to find out more information that diabetes can provide you with, and also whether you would like an email being sent through to you, which will then also print out a letter that you can take then to your GP to say, you know, if you're at high risk or not. Next slide. So then what it does is that the tool then gives you your score, your at-risk score, and it also tells you sort of how it's arrived at the score it's been delivered. So the things on the left-hand side of the screen is things that you just can't change. That's just what, you know, Mother Nature has given you, which is your age, your gender, and your ethnicity, and whether you have relatives who have a family history of diabetes. But on the right hand side of the screen, it shows you things that actually somebody could take control of. So if they're, you know, if their score is at high risk, it shows you then that maybe just by, you know, maybe, you know, just by reducing your weight measurement or reducing your BMI, how just by changing those few points would actually make you at less risk of developing type 2 diabetes. So it shows you things that unfortunately you can't control, as well as things that you could control. So you could just look on there and think, well, actually, you know, maybe just losing 2 centimeters around my waist would actually bring me down into a lower risk of developing type 2 diabetes. So it's a really engaging tool to show why the results are the way they are. Then the next slide says that we will, if we email your address, we will send you a letter to your that you can then take onto your GP, and that we also encourage that people do speak to their GP about having a blood test, and then you can just put your contact details in there and we will send that out to you. Next slide. This side here just explains that we have got risk guides, Know Your Risk guides, explaining the Know Your Risk tool in different languages. The image in the middle is a new resource that has just been developed by Diabetes UK, which explains, you know, what you can do if you find out that you are at risk of developing type 2 diabetes. It gives you helpful hints and tips on how to, you know, maybe change your lifestyle habits to, you know, help reduce your risk of developing type 2 diabetes. And then the last image on that slide is just our new poster that we've developed as well, knowing the symptoms of diabetes, what to look out for, you know, whether you're losing weight, whether you're becoming thirsty, whether you become tired, the 4 T's, and that's there too. And that's my presentation, and thank you very much for listening.
Going to move to Katie now and hear from Katie from Reed Wellbeing. Just one second.
Hello, I think I'm live now. So my name is Katie Kopak and I work as a coordinator on the NHS Diabetes Prevention Programme. Okay, next slide. So the Healthier You programme is free and it is a community-based behaviour change programme for those who are pre-diabetic. And the aim of the programme is to reduce that risk and to stop those people going on to develop type 2. So the programme is made up of 13 group sessions. Every session is an hour and a half. It's a different topic each time, and these groups are booked up to about 20 people. The sessions are spread out actually over 10 months, so it's quite a long programme. The first 4 sessions are fortnightly, and then the next 9 sessions after that are once a month. Reason it's such a long programme is, as I said, this is behaviour change. We know that it takes at least about 6 months to really change behaviour, change habits, modify them, adapt them. So that's why, you know, it is that length of time. The programme has been developed by experts and underpinned by a lot of research into how a prevention programme works best, and that is in groups in the community. So the participants get a lot of support in this group environment, and the group is facilitated by a health and wellbeing coach, and participants will have that coach for the whole thing, for the 13 sessions. So they build really nice relationships in those groups. And we do also have a digital stream, which I'll talk about in a little bit. Next slide. So to be eligible, firstly, a patient must be registered to a GP practice in the contract area. So we're talking about West Yorkshire today. They need to never have been diagnosed with type 2 diabetes previously. They need to be an adult, so 18 plus. And probably most importantly, they need this HbA1c test score of 42 to 47, and that has to have been done in the past 12 months. And also to not be pregnant at the time of referral. So those are the eligibility points. If a patient has a previous diagnosis of gestational diabetes, then they are also eligible if their HbA1c is less than 42 in the last 12 months. Where a patient is over 80 years old, we really need to know from the GP with written confirmation that the benefits of them coming on the programme would outweigh any potential risks associated with losing weight for that individual. So that conversation really needs to have happened. Referrals can be made in 2 ways. So first up is sort of inviting patients. This could either be done by letter, and it's not included on there, but also SMS text as well. So we invite patients to contact us, or opportunistic, where following a health check, an annual review, or some sort of consultation with a healthcare professional, they can then send an e-referral form to us, and we then contact the patient. Next slide. So the first phone call that we'd have with the patient is called the individual assessment. We aim to get in contact within 5 to 10 working days. These phone calls last about 15 to 20 minutes, and our advisors who are on the phones are really trying to establish if this participant is motivated, if they're going to commit, if it's suitable for them. Now, mostly today I'm going to be talking about the face-to-face sessions in the community, but we do have a digital stream where patients complete the course on an app. So that can either be on their smartphone or tablet, and we typically sort of suggest this when patients can't commit to the fixing sessions. So maybe they do shift work and it's constantly changing. Maybe they've got a young family. So where it might be best for them to do it in their own time at home. If the patient turns down the service, then we may signpost for other services as well. And then in those sort of greeny blue boxes, just sort of the steps that we go through in that engagement call. So we explain a bit about type 2 diabetes and its implications. We deliver a little bit of a brief intervention in line with NICE guidelines, advice for smoking cessation if needed. We then at that point would book onto the programme, so match them up with what we've got in the area. And then we also just signpost to our website as well. Next slide. So the course has 4 key principles that it is based upon. First one being goal setting. This is a massive part of the course. They set SMART goals and they set 2 per session. So they're relevant to what they've just had the session about, 2 per session. And then nicely linked to that is also reviewing. So at the start of every session, they do a review on how the past 2 or 4 weeks have been and how they've got on with those goals that they previously set. Then we've got monitoring. So patients get a workbook and the back third of the book is called their lifestyle logbook. Here they have a weight tracker, a step tracker, a food diary. So, you know, they need to be tracking behaviours in order to understand where they're at with them, their baseline, and then where we can change them from there. And then lastly, supporting. It is a really supportive environment for patients. They're with people who are in the same boat as them, and the coaches, you know, are really enthusiastic in helping them to make changes. Next slide. The programme content. So as I said, there are 13 sessions and these sessions come from sort of 3 areas: physical activity, nutrition and behaviour change. So they have 2 on physical activity, Make Everyday Active, which is just sort of an introduction, Fitter, Healthier, Happier, goes into more depth where they learn about cardiovascular exercise versus resistance training. Nutrition, they get 90 minutes just on carbohydrates, just on fats. It's actually missed off there as well, but sugars. So they go into a lot of depth with that and how each of the food groups affects their blood sugar. And then behaviour change. So know your triggers. They learn about things that maybe internally and externally trigger them. Mind matters. They learn about helpful and unhelpful thought patterns. So it is sort of really broad, you know, broad content but in those 3 areas. Next slide. The coaches. So as I said, the coach will deliver the whole programme for each group. So they are really on hand there to support the patients. The coaches come from various backgrounds, cultures, communities, and they do have a range of qualifications and experience. So that's really nice. We've also got coaches who speak different languages, and we do run some language specific groups. So in Bradford we have Urdu groups, Urdu only speaking groups. Currently the West Yorkshire team has 12 coaches that deliver for us. Next slide please. Just some patient outcomes. So since the contract start in June 2017, 10,544 patients have attended a session. We've got the average weight change of losing 3.92 kg, and then you can see there 16,000 in total. Common reported outcomes: increased physical activity, more energy, definitely reducing other health problems. That one is mentioned a lot. Normal HbA1c, so that is the goal, to get below 42. Improve mental health and sleeping better. Next slide, please. Some good news stories to share. So we've got a lovely before and after here of a participant who has gone from size 14 to size 10. Never thought she'd wear those clothes again. Course has given her the motivation and help she needed. Lost 24 pounds. Another one there at the bottom. We've had the HbA1c reduced from 43 to 40. Altered eating and exercise habits, using the traffic light system. So we really teach them how to read labels on packets of food. More exercise, cut down on starchy carbohydrates. Next slide, please. We've also got a little video here from Peter. I'm quite proud to say Peter was actually a participant that I coached myself. So hopefully the video works. Just got his thoughts on the programme. Have you, when you shared your screen, there's a tick box for include computer sound. I'm not sure if you'll have to unshare and then share again, if that's possible with the live stream.
Rachel, is that something you can do?
Still not got it.
It doesn't appear to work, but we can get the we can share the slides afterwards for anybody. I'm just sending a link out to somebody who's asked in the Q&As. So we'll move on from here, Katie.
Yeah. I think there's just one more slide after. Yeah, there we go. So that's my presentation done. Just that link in that blue bubble is a little sort of promotion video which just goes through the whole programme again, covers everything I've said. But thank you very much for listening today.
Thanks, Katie, and thank you everyone for our guest speakers and sharing your knowledge and wisdom with people this dinner time. So we've got some questions in the chat, and then we've also got a couple of questions that were sent separately. So I'm just going to read out some of the questions and get the answers, and then we'll wrap it up for today. So question 1, to any member of our panel that feels they have a helpful response. When is the best time to seek help for any diabetes symptoms or suspected type 2 diabetes symptoms? And can we just remind the audience what specific symptoms we're looking for in terms of type 2 diabetes, please? Waqas, do you want to go first?
Yeah, absolutely, not a problem. Yeah. So if we look at common symptoms, it can be as vague as just fatigue, tiredness, but usually we're looking at which colleagues at DUK would also highlight is the T's. The 4 T's, the easiest way to remember. So again, tiredness, if they're very thirsty, and they're weeing very excessively, as well, so and they're losing weight, so they're thin as a result of that. So those are the common things that I would probably say to make it nice and easy to focus on, perhaps.
Thank you. Lisa, anything to add from you on that one?
No, not really. There's a couple other ones. Maybe they're finding that, you know, if they get in cuts or anything to the hands, that they're taking longer to heal, and also if they're suffering from urine infections and thrush.
Thank you. Okay. Another question that came in via the chat was about innovative ways of supporting and signposting patients. Anyone can answer that one, whoever's got any thoughts coming to the front of your minds.
Well, Diabetes UK do have an online forum that's available through our website. So if anybody needs, you know, any of that extra support, have that peer-led That's obviously available on our website in the forum pages. Also, we have numerous Diabetes UK support groups dotted around the county. And again, if they go on our website and look at the support EU pages, there's details there as well.
Thanks, Lisa. Another question about advice, thinking of support and health workers who have been told by their doctor that their patients are pre-diabetic. How can they help and support their patients? Waqas?
Yeah, absolutely. So I think, like I alluded to earlier on in the conversation, I think it's putting all this together from Lisa and Katie and myself. So one side that you've identified it, or you're just looking at someone and you think, you know, these things are coming to my mind, or they're asking certain things, or they're either overweight or there's other health problems. So that's the first thing in terms of recognition that someone may be at risk. Obviously, in this case, they've already been identified that they are at risk. So I think from there, the next thing is around how we actually support them to engage with Katie's team in Read Wellbeing, and I think that's the link up that we can do. So again, it's looking at that person's or that service user support network, having conversations. How able are they to attend? You know, what sort of support do they need in that way? Explaining what the program is as well often is a useful thing, so they know what they're getting themselves into, and if they're able to do that as well. And if those things don't work, then I think it's again getting back to their doctors and having a conversation in terms of what else can we do to support someone. So for instance, if they're very frail, or for instance if they've got multiple joint problems, or certain things where we think actually this program might not be suitable for them, or the support that might not be suitable, there are lots of other things that we can do for that service user.
Thank you. And then this one's to Lisa and Waqas. So what's the personal impact of someone having diabetes? Lisa, you go first.
Oh, there is a lot of personal impact on somebody having diabetes. Unfortunately, people who have got type 2 diabetes are 33% more likely also having depression. So you have a high risk of being depressed. There's also, you know, when we speak to people with type 2 diabetes, there's a lot of stigma and misinformation out there. So a lot of people, you know, we don't like to admit to it that they have type 2 diabetes because of that associated stigma. On day-to-day living, there is, you know, they have to have their annual health checks, they have to have time off work to attend education. There is, you know, the pressure of being more active, as well as having all this with their day-to-day lives. So there is quite an impact on there, both physically and emotionally. And we do, you know, try to provide that support and that peer support, professional support. We have a helpline as well for anybody, free helpline, anybody who needs that support too. So, yeah. Waqas, what would you like to add?
No, I think, Lisa, you put that very eloquently, and it is looking at things through the eyes of someone with that condition. So if you were to ask clinicians, we obviously get worried about the health outcomes or the health complications, which, if we put in a nutshell, are either large things, so they affect the heart attacks, stroke, or other smaller blood vessels like foot disease, foot ulcers, kidney problems, visual problems, unable to see, and things like that. And so those are the sort of health concerns. And like Lisa alluded to, it can impact on multiple levels. Psychologically, a big one. Also managing this, going through so many different appointments for so many different checks, taking different medication, number of tablets. They may need to be on injectables. They may need to be on several injections in a day. So again, depending on every individual, the complexity of how they cope with it, how they get supported with it is very burdensome for people. And then obviously we mustn't forget, in the current climate, a lot of this has then socioeconomic impact in terms of how they work. They have to start thinking about, when do I have my meal? What type of meal can I have? How much stuff's in it? So it's got multitude of effects in terms of how we can just not think about anything and crack on and eat and drink and do different things. They have to look after themselves in a very different way, and therefore there's a lot of planning quite often they have to do. And I think those sort of things which often we don't see, we don't talk about, but it does make their life complicated when we do talk to the person with diabetes.
Thanks, Vikas. We do have one last question, but I'm just conscious of time, so I'm going to hand over to Adele to talk about the programme options, and then if we've got time at the end, we'll cover that last question. Adele, over to you.
Thanks, Laura, and happy World Diabetes Day. I'm just going to run through a couple of the programmes that are free and available to patients within West Yorkshire. Could you bring up the poster slide, please? So we have this poster designed, and it's just a reminder of the programmes, like I said, available to healthcare professionals. We've got the Healthy Living app, and this is Healthy Living for adults with type 2 diabetes, and it's nationally commissioned. This is a free structured education programme, and it's web-based, so patients or carers must have an email address. And the contents has been culturally adapted, so it's a really good programme, is that, for type 2. We've got My Type 1 Diabetes. This again is a free digital resource with tailored support to help adults that live with type 1 diabetes. My Type 1 Diabetes helps you understand more about type 1 diabetes and increase your confidence on how to manage it. This comes also in a number of resources and other languages like Polish and Spanish. And then we've got the NHS low calorie diet, which we rolled out on March this year in West Yorkshire. And this is a free 12-month programme for people living with type 2 diabetes. And the aim of the programme is to reduce weight and maintain weight loss achieved. It also reduces medication usage as well. The low calorie diet uses a total diet replacement products, which is basically the soups and shake diet for 12 weeks. And as you can see, it's got a quite complex criteria there. We've got the NHS Diabetes Prevention Programme that Katie covered earlier on by going through her slides. What we would advocate is this be the first choice for any patients who are pre-diabetic. So I won't go too much into the NDPP. And then we have the NHS Digital Weight Management Programme. So referrals to this programme, as you can see, are for people who meet the below criteria, but also for colleagues who are employed by the NHS. So this is a self-referral programme for members of staff working in the NHS, whether that includes bank staff or on temporary contract. You must have a valid NHS email address, and there's a link to actually sign to self-refer into the programme. It's, like I say, it's 12 weeks. It's a weight management plan to support you on your journey to a healthier lifestyle. So that just rounds up a couple of the programmes that are free and available, and you can support your patients either at risk or to manage diabetes. Next slide. And I just want to quickly remind you about the number of e-learning modules aimed at healthcare professionals or the voluntary sector who engage with people as part of their role and who are interested in supporting people with excess weight. So we've got the Personalised Care Institute. They've got a really good module called the Personalised Care and Support Planning programme, which is a 45-minute programme. I've recently done that. It's great. We've got the LFH, again, this is for health and wellbeing coaches, a really good healthy weight coach programme. And then we've got the RCGP, which is the NDPP e-learning programme. And finally, the Cambridge Diet education programme. This is bite-sized learning for registered and unregistered healthcare professionals. We've purchased a number of licenses within West Yorkshire, and we've shared them out to place. So if you want to try your hands at the CDEP programme, please do contact your diabetes place leads. And finally, what we would ask you to do is if you could fill in the valuation form, we can then send you the deck slides. That's it from me. Thank you.
Thank you, everyone. So I'm just going to wrap this up for everyone. And first and foremost, I just want to thank my distinguished colleagues who have been on the panel with me, and also the people behind the scene. But more importantly, this is about you, and thank you for giving us your time to come and attend this and be a part of World Diabetes Day with us today, because it is everyone's business. So today I hope, just as a recap, that you'll remember that we started with in terms of why it is important, how everyone can help, how you, when you next see your service user or client, half an hour later perhaps, you can do a certain visual check, certain check on their health, on their health or their past history. From there, you might be intrigued to support them in identifying the Know Your Risk tool. And from there, if conversations go really well, you might be able to entice and engage with them and support them to join the National Diabetes Prevention Programme. So I hope that, you know, that's been made very clear. And then again, thank you to Adele at the end for just highlighting that there are lots of other NHS-led support programs for the person with diabetes and different types of diabetes, whether that's a digital, whether it's face-to-face, whether it's in a group setting, whether it's for someone who has type 1 diabetes, a different form of type diabetes, or even whether it's someone who might have different health problems, who's just overweight or is carrying excess weight. So there's lots of different things designed based on people's needs, and I'm hoping that you can all support us in providing better care and helping this sort of population health message. And last but not least, it's to remember the evaluation. We really value those, because it allows us to tweak things and change things for next year, when again it will be World Diabetes Day. And for me, just as a last minute point, it is more of a mission for all of us here to pick up the baton, no matter who you are. So I'll do that as a clinician. We have colleagues here from different providers, from DUK, from different charities, and you are in the screen there as you know, your contact, you see these people. So, you know, for me, one of the big thank yous and take-home messages would be, just think, could this patient have pre-diabetes? And hopefully we've given you the tools or shown you some paths as to how you can support that person or that service user to engage with us as well. So thank you. Thank you for doing a fantastic job that you all do.